Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
And welcome back to our Healthy Living edition of KUAM News Extra. Once again, please welcome Dr. Jitka Lom from Express Care. Thanks for being with us. Tonight we are talking about menopause and hot flashes, and I'll start things off with, first for our viewers, what exactly is menopause and what are the symptoms?
Menopause is when your ovaries basically go into retirement. They've been working very hard since you were about age 12 or 13. Until around 45 or so, they start getting very, very tired and not producing as much hormone. Eventually, they pretty much stop producing the hormone altogether, and so there's a big drop in your hormone levels. As a result, the body experiences that as a deficiency, especially in parts of the brain called the hypothalamus. And that's the area of the brain that controls our temperature regulation. So as a result, our temperature can rise very suddenly in our skin, particularly sometimes the hot flashes, if they measure the temperature of the skin can go up 2 to 7 degrees hotter than regular. Inside the body, the core temperature remains the same, but it's very uncomfortable on the surface of the skin for many women.
Mm-hmm. What exactly, again, are hot flashes, and what can be done to control them?
Well, the hot flashes occur when the body perceives that there's not enough estrogen in the body and the brain doesn't regulate the temperature as well as it used to. The hot flash will occur, it might last 10 or 15 minutes at the most and then go away. It might be accompanied by palpitations, sweating, a very uncomfortable, anxious feeling, and then it'll go away. And to prevent them, we should live a very healthy lifestyle. One of the most important things is exercise, because when we exercise, we're mobilizing fat. Fat contains stores of estrogen in our body. So when we're breaking down fat by exercising, we're releasing estrogen. That helps our body with the hot flashes.
What about perimenopause? What exactly is that?
Perimenopause is the lead up to menopause. Menopause isn't just sort of falling off a cliff when you're age 50. You start maybe around age 35 or 38, even in your early 40s, and then gradually coming up to the average age of 50, your hormone levels will decline. So in that age group between 40 and 50, your periods may become quite irregular or very heavy. Quite a lot of changes with the periods, more premenstrual symptoms such as PMS, back pain, headaches, irritability, until gradually you get to menopause. And the actual definition of menopause is no periods for 1 whole year.
I see. What about the risk? Why does the risk of osteoporosis increase during the onset of menopause?
Well, in our childbearing and fertile years between ages of 20 and 40, we're in a bone maintenance phase. Up until 20, we're still building bone. From 20 to 40, we're maintaining. And what happens in the skeleton is that we're always resorbing some of our bone, meaning that we're breaking it down, and then we're always building it up again. So our skeleton changes over. About every 10 years, we have a completely new skeleton. And when we hit menopause age, that resorption is not controlled as well. So we will be absorbing more of our bone than we're building up, again, because of a lack of estrogen. So what happens is that you're breaking down more bone than you're building up. As a result, you end up with an effective loss of bone and thinning of the bones, more fragile bones, eventually leading to fractures, especially broken hips.
And we talked a lot about some of the physical symptoms and things like that, but emotionally, do women change?
They sure do, yes. The change in hormone levels has a profound effect on women, and in particular, progesterone, it's the mother hormone, the one that women feel very good during the second trimester of their pregnancy. They're glowing, they feel great. That hormone has dipped down in menopause. Estrogen has also come down, giving them lots of uncomfortable symptoms like the hot flashes and headaches and difficulty sleeping. That affects their mood also. Plus there's the emotional component of having lost their fertility and moving on into a new phase of their lives.
Okay. Well, thank you. We're going to continue our discussion with Dr. Lom on menopause. We'll take your questions after this.